Osteoporosis affects 500 million people. That's 500 million people around the world, making their bones weak and fragile. It can be so serious that even a cuff can cause a fracture. The elderly, particularly women, are most at risk. That poses a problem here in Asia, where the number of people over 65 is expected to triple by the year 2050. Joining me now in the studio is Dr. Cyrus Cooper, the president of the International Osteoporosis Foundation. He's in Singapore for a talk, and he visits us from London. Thank you so much for joining us, Doctor. First of all, why are women most at risk with osteoporosis?
The principal reason, Rico, that women are at increased risk is that at the time of the menopause, the ovary reduces its secretion of estrogen, and that results in more rapid bone loss. And so osteoporosis-related fractures are much more common in women than they are in elderly men.
And does that happen for women also at the advanced age of 65, or can it be at a younger age?
The earliest age at which you see the divergence between the fracture rates in men and women is from age 50, which is the approximate age of the menopause, but that widens as you get to older ages above 65.
And what about for men? When is the greatest risk for them to have osteoporosis?
For men, fracture risk rises smoothly with age, so the older male is also at greater risk than the younger male.
And how can this risk be reduced, Doctor?
So it's really important to recognize in terms of a previous history of fracture. And one of the global initiatives being undertaken, known as Capture the Fracture, identifies a person who's had a fracture, evaluates their risk factors, and assesses their bone density with a very simple bone density scan, and then determines whether they warrant treatment. And for example, here in Singapore, a wonderful such fracture liaison service has been established at the General Hospital.
And what must we eat or drink to be able to stop this osteoporosis from affecting us?
So the diet and exercise are the two principal preventive measures. In terms of diet, attention to calcium nutrition and vitamin D status are the most important. Calcium nutrition is particularly important here in the Asia-Pacific region because traditionally the diet is relatively low in those dairy products which give us our calcium.
Absolutely. So tell us, Doctor, how has the treatment of osteoporosis evolved over the decades?
So this has been a tremendous advance over the last 3 decades, from a disorder like grey hair or thin skin advancing with age that you can do nothing about. We now have assessment of risk, as I mentioned, and a series of drug treatments ranging from oral treatments, tablets once a week, intravenous treatments, and subcutaneous injections, all of which reduce fracture risk by 50%.
Thank you so much for sharing with us your research, Dr. Cyrus Cooper, an osteoporosis expert.
Thank you very much indeed.